Hello, and welcome to the first episode of hashtag CR Arthritis from the Canadian Rheumatology Association's annual scientific meeting and the Arthritis Health Professions Association pre-course. We welcome you, and today we're joined by ACE President Cheryl Koehn.
Thanks, it's great to be here.
As many of our audience know, the CRA and HPA annual meetings are the largest and most important annual arthritis events in Canada, holding tremendous value, not only for healthcare professionals, but for people with arthritis and patient organizations like ACE. And we are hosting our 11th annual hashtag CR Arthritis program, which builds on the tremendous success of our previous YouTube, Facebook, and Twitter X, now X events at the annual meetings. Cheryl, what I think maybe to start is how does this program work, and how has it evolved, and what kind of impact has it had on the arthritis community over the past 11 years?
That's a great question. Always start at the beginning, hey? I think, Kelly, the most important thing that has developed over the years and continues on is the hashtag C Arthritis event hosted by Arthritis Consumer Experts has been such a tremendous sort of meeting ground, if you will, of basic scientists, clinical scientists, and clinicians, patient organizations, and also patients who were involved in research or in education and knowledge translation and exchange. So I think the best way to describe hashtag C Arthritis is it started as us infiltrating the CRA meeting years and years ago, and then showing the collective community that this dialogue that we have during these interviews with those folks attending the meeting is a great way to, I think, role model patient-clinician conversation. I think it's a really important forum for asking our experts in this area, our clinical and basic research experts, to talk in lay language with us. And that being a great sort of training ground, and then getting the knowledge out to both the arthritis public, but also the general public, and we hope the mainstream media. So I guess succinctly put, a meeting ground for people in our community to come together and exchange knowledge in ways that are real, tangible, and easily communicated.
I'm going to build on that for our audience who's watching or listening, and that is this idea about translation and knowledge exchange. What is the value of that for people with arthritis, and what kind of ways can they apply it?
Well, Kelly, there is this old adage, I know you've heard it many times, as has probably everyone watching today: knowledge is power. So this knowledge exchange that we have in hashtag C Arthritis is really intended to help power people out in the arthritis community, to actually give them the knowledge that has traditionally been cloistered away in academia, in research journals, in clinical offices, so to speak, and get it out on the street. And how it applies, how that knowledge gives you power, and how it applies then to your own life living with arthritis. I'll speak from just my own personal experiences. I gain the vocabulary that my clinician has, and I can kind of level the field a bit in terms of, again, I'll say use the word power, the power structure that is in the healthcare system. It brings me closer to the center of power of my own life as a patient. It helps me make better decisions for myself, right? It helps me be a better self-carer. Ultimately, I'm the one that has to make the decisions and follow through, execute on my decisions, and also to check in and see if those actions are actually helping me. So to me, Kelly, that's what this is all about. Knowledge is power. And then how do you apply that knowledge power to your own disease situation, your own life situation, and action. It's action oriented.
And speaking of action, how can our audience members, people living with arthritis, how can they participate and get involved in the event?
So they can go to any one of the social media channels that this is being broadcast on, which is X, Facebook. Notices will go out via Instagram as well, but primarily you can interact and engage with the program through Facebook and through X. And also we are posting to Blue Sky, but it's still in its growing phase, but we really encourage people to start an account over on Blue Sky as we're becoming more and more active there, as are other influencers in our community. But so first they can go and they can follow the hashtag CArthritis, CRARTHRITIS. And they'll get, if they go to that hashtag, they'll see the stream of posts, the stream of comments, and they can begin to see how interactive this is, and they can help drive those interactions. They can share those posts with the people in their own arthritis network, Kelly. I think sharing is caring, another old adage, but very true in this setting. And really be to sort of just try to dive in, become part of the community. You can turn the comments features off on your own feed if you don't want to get any feedback back from your comments. But we really just encourage people to engage. Engagement is where action and progress happens.
And of course, the one of the most important platforms is our very own Arthritis Broadcast Network.
Mm-hmm. Absolutely. So ABN is the primary carrier of the feed. You can follow ABN or Arthritis Broadcast Network on these channels, both on Facebook and on X. Arthritis Consumer Experts carries the feed as well. So just myriad ways to get involved. But I think first and foremost, Kelly, most important part of engagement is watch the videos, watch these experts and learn from them. It will hopefully spark an idea about their own, someone's own perhaps struggles. It might motivate them to reach out to their caregiving team to try to solve a problem they've been living with and didn't realize there was a solution available. And also just to get connected with the community. That's power in and of itself.
Indeed. And this year's annual meeting hosted by the CRA and AHPA is titled Ascending to New Heights, Peaks of Innovation in Rheumatology. And it's celebrating the latest advancements and breakthroughs. And it's interesting because you spoke in quite a bit of detail about knowledge translation and exchange. And one of the sessions I'm looking forward to is going to be led by one of ACE's good friends, Dr. Janet Pope. And she's going to be doing a session around the critical role of knowledge and translation and exchange. Are there some other sessions or speakers that you're looking forward to, Cheryl?
Absolutely. Actually, the speakers list this year is tremendous, as it is every year. But I think I look at the program each year, Kelly, and I get more and more excited. Along the lines of this year's theme, first of all, it's really important to honor the people that have been incredible champions and scientists in our community. And it's really exciting to see Dr. Daphne Gladman be given the Dunlop Doddridge Lecture. She's going to be talking specifically about the road to a new horizon in psoriatic arthritis. So, psoriatic arthritis is a really difficult disease, sometimes presents with the arthritis first, followed by the psoriasis piece, or can be that someone is living with psoriasis and then several years later or many years later go on to develop the arthritis piece. So so excited to hear what Dr. Gladman has to say about this disease and to look at the new horizon with her through her eyes. She brings such tremendous experience, and both from a scientific perspective, but also as a practitioner herself. I'm also really looking forward to the keynote lecture. Dr. Mandami is going to talk about artificial intelligence in medicine, a really topical subject. We see it in mainstream media. We see it in the medical media today, Kelly, as you well know. So super excited about that. Dr. Joan Wither is going to be giving, is one of the speakers, and is the Distinguished Investigator keynote address, and she's going to be talking about personalized medicine. Other buzzwords that we've been hearing a lot about over the last few years, but she's going to talk specifically about an approach to prevention and treatment of systemic or systemic autoimmune rheumatic diseases, or SARDs. So those are a group of diseases that often are more difficult to treat. And then there's lots and lots of workshops going on, Kelly. There's new clinical practice guidelines for the management of lupus nephritis. Dr. Avinia Zubieta will be talking about those, as well as Dr. Kim Chima. A workshop on closing the gap between primary care and rheumatologist, which is super, super important. There's going to be folks who are focused on occupational therapy who will be speaking, as well as other clinical practice experts. Sean Brady from the Arthritis Society Canada will be speaking, which is super exciting under that workshop. So just those are some sort of my top of mind speaking roles, or those folks who are speaking, Kelly, that I plan on taking in. I think the challenge of this meeting is always, how do I spread myself, or how do we spread ourselves thin enough to catch all of the great speakers? But those are just a few of my highlighted sessions.
Fantastic. And just a reminder again to our audience and viewers, the meeting starts on February 26th and runs to March 1st. And they can start looking for those interviews that are going to be published once again on the Arthritis Broadcast Network, YouTube, Facebook, and X pages using the hashtag CRAArthritis. Cheryl, thank you so much. Good luck at the conference.
Thank you. It's going to be exciting. I look forward to seeing all of our colleagues there.
I think on behalf of both of us, special thanks and shout out to the CRA and HPA for including us again at their event and annual meetings. We really do appreciate our collaboration with both of them. And finally, thanks to everyone out there watching. We look forward to sharing more of the exciting science with you coming from the CRA HPA annual meeting in our next episode of CR Arthritis. Thank you, everyone. Bye-bye.